Atherosclerosis is a condition where the arteries become narrowed and hardened due to a buildup of plaque, which can lead to serious cardiovascular issues. This guide explores the intricacies of atherosclerosis, including its risk factors, which range from lifestyle choices to genetic predispositions. Additionally, we will delve into peripheral vascular disease and peripheral artery disease, both of which are linked to atherosclerosis and can significantly impact circulation and overall health. By understanding these conditions, their risk factors, and their effects on the body, you'll gain a clearer picture of how to manage and potentially prevent these vascular diseases. Atherosclerosis happens when plaque, a sticky mix of cholesterol, fat, calcium, and other substances, builds up inside your arteries, which are the blood vessels that carry blood from your heart to the rest of your body. This buildup can block blood flow and lead to clots, increasing the risk of heart attacks, strokes, and peripheral artery disease, PAD, all of which are types of cardiovascular disease. Atherosclerosis can affect any artery in your body, but is most common in the large arteries that supply blood to your heart, brain, stomach, lower body, and kidneys. Fortunately, it can be both prevented and treated. While atherosclerosis and arteriosclerosis are similar, they are not the same. Arteriosclerosis refers to the stiffening and thickening of blood vessels, which can restrict blood flow. Atherosclerosis is a specific type of arteriosclerosis. The exact cause of atherosclerosis is not fully known, but it is thought to start when the endothelium, the thin layer of cells lining your arteries, gets damaged. This damage can begin early in life and is often caused by high cholesterol, high blood pressure, inflammation from conditions like arthritis or lupus, obesity or diabetes. Smoking. Atherosclerosis progresses through distinct stages, each contributing to the worsening of the condition. In the initial phase, known as the fatty streak, LDL cholesterol begins to build up inside the artery walls. This early stage, which can appear even in children, typically does not present any symptoms. As the disease advances to the fibrous plaque stage, the cholesterol and cells form a more substantial plaque that bulges into the artery. This growth can eventually cause narrowing and may lead to symptoms such as pain or discomfort during physical activity. When it comes to symptoms, atherosclerosis may not be noticeable until significant blockage occurs or until a major event like a heart attack or stroke happens. The symptoms vary depending on which arteries are affected. For those with heart-related symptoms, issues may include irregular heartbeats, chest pain or pressure, and shortness of breath. These symptoms are linked to the arteries supplying blood to the heart. In cases where the arteries to the brain are impacted, symptoms can include numbness or weakness in limbs, difficulty with speech, drooping facial muscles, and vision problems. These signs indicate that blood flow to the brain is compromised. For arteries in the arms, legs, and pelvis, symptoms often involve pain while walking, numbness, cold feet, and sores that do not heal. These issues are indicative of poor circulation in the extremities. Finally, if atherosclerosis affects the kidneys, it can lead to high blood pressure and, in severe cases, kidney failure. These symptoms reflect the impact on the arteries supplying blood to the kidneys. By understanding these stages and symptoms, you can better recognize and manage the effects of atherosclerosis. Atherosclerosis can begin at a young age, with studies showing that even teenagers may show early signs of the condition. If you're around 40 and otherwise healthy, there's about a 50% chance that you could develop significant atherosclerosis at some point in your life. This risk increases with age, and by the time most adults reach 60, they have some degree of atherosclerosis, though symptoms may not be apparent. Several factors can elevate your risk of developing atherosclerosis. These risk factors contribute to over 90% of all heart attacks. Abdominal obesity, often referred to as a spare tire. Excess fat around the abdomen significantly raises your risk. Diabetes and insulin resistance. These conditions disrupt your body's ability to regulate blood sugar and increase the likelihood of atherosclerosis. Family history of heart disease. If close relatives have had heart disease, your risk of atherosclerosis is higher. High alcohol intake. Consuming more than 1 to 2 alcoholic drinks per day, depending on your size, can increase your risk. High blood pressure. Elevated blood pressure can damage artery walls and contribute to plaque buildup. Sleep apnea. This condition, where breathing stops and starts during sleep, can increase your risk of heart problems. Smoking. Tobacco use is a major risk factor, damaging blood vessels and promoting plaque buildup. Stress. Chronic stress can contribute to the development of atherosclerosis. Despite these risks, the rates of death from atherosclerosis have decreased by 25% over the past 3 decades. This progress is attributed to advancements in medical treatments and healthier lifestyle choices. The diagnosis of atherosclerosis typically begins with a physical exam by your doctor. They will listen to your arteries and check for weak or absent pulses, which can indicate problems with blood flow. To confirm the diagnosis and understand the extent of the condition, several tests may be required. Angiogram. Your doctor injects a dye into your arteries to make them visible on an X-ray. Ankle brachial index. This test compares blood pressures in your lower leg and arm to assess blood flow. Blood tests. These tests measure factors like high cholesterol or blood sugar, which can increase your risk of atherosclerosis. Carotid ultrasound, abdominal ultrasound, chest, X-ray, CT scan, or magnetic resonance, angiography, MRA, Doppler, ultrasound, echocardiogram, EKG, electrocardiogram. Stress test, depending on the results. You might need to consult specialists such as cardiologists or vascular doctors. Atherosclerosis can lead to 3 main types of cardiovascular disease. Coronary artery disease. Stable plaques cause chest pain, angina, while sudden plaque rupture and clotting can lead to a heart attack. Cerebrovascular disease. Plaque rupture in brain arteries can cause strokes or transient ischemic attacks, TIAs, which are temporary warning signs of a stroke. Peripheral artery disease. Narrowed arteries in the legs cause painful walking and poor wound healing. In severe cases, amputation may be necessary. Understanding these diagnostic procedures and potential complications can help in managing and treating atherosclerosis effectively. Once you have a blockage from atherosclerosis, it typically remains. However, with the right medications and lifestyle changes, you can slow or even stop the progression of plaque buildup. In some cases, aggressive treatment may even lead to slight shrinkage of plaques. Lifestyle changes. Addressing risk factors through lifestyle adjustments is crucial. Adopting a healthy diet, engaging in regular exercise, and quitting smoking are essential steps. Medication. Medications can help manage high cholesterol and high blood pressure, which in turn may slow or halt atherosclerosis. Drugs for controlling diabetes are also important, as diabetes increases the risk of atherosclerosis. Your doctor might prescribe antiplatelet medications like aspirin to prevent blood clots. However, because long-term use of aspirin can lead to stomach bleeding, it's important to consult with your doctor before starting a daily aspirin regimen. For more severe blockages, your doctor might use more invasive techniques. Angiography and stenting. A thin tube is inserted into an artery in your leg or arm to access diseased arteries. Blockages are seen on a live X-ray screen. Angioplasty, which involves a balloon-tipped catheter, and stenting can often open blocked arteries. While stenting alleviates symptoms, it does not prevent heart attacks. Bypass surgery. A healthy blood vessel, usually taken from your leg or chest, is used to bypass a blocked segment of your artery. Endarterectomy. This procedure involves removing plaque from arteries in your neck to restore blood flow. In some cases, a stent may also be placed. Fibrinolytic therapy. A medication dissolves a blood clot that's blocking your artery. Next we have the peripheral vascular disease, PVD. PVD is a condition where blood vessels become narrow, blocked, or spasm, disrupting blood flow. It can affect any blood vessel outside the heart, including arteries, veins, and lymphatic vessels, leading to inadequate blood supply to organs like the brain or legs. The legs and feet are most commonly impacted. PVD is also known as peripheral arterial disease, PAD. The link between atherosclerosis and peripheral artery disease is as peripheral artery disease, PAD, is caused by plaque buildup in the arteries of the legs, arms, and pelvis, reducing blood flow to these areas. This condition, related to atherosclerosis, is common among older adults, dialysis patients, diabetics, and smokers, but is often not diagnosed or treated properly. Symptoms include leg pain or numbness, slow nail growth on toes, and sores on the feet or legs that don't heal. Early stages of PAD may show no symptoms at all. As PAD progresses slowly with age, people often mistake symptoms for normal aging. By the time PAD is diagnosed, the damage might be so severe that amputation is necessary. In summary, understanding atherosclerosis and its related conditions is crucial for managing and preventing serious cardiovascular issues. This guide has covered the complexities of atherosclerosis, including its risk factors and stages, and its connection to peripheral vascular disease, PVD, and peripheral artery disease, PAD. By recognizing the symptoms and understanding the diagnostic procedures, you can better address these conditions. Although atherosclerosis can begin at a young age, lifestyle changes and medical treatments can slow its progression. Early detection and proper management are essential to reduce the risk of severe complications, such as heart attacks, strokes, and limb amputations. Please click on the next video for more Live Good info. Thank you very much.